Hello everyone, and welcome back to the Healing With It podcast. I'm your host, Kirsten, as most of you probably know, and today I am super excited, as I always am, about these interview episodes because I think they just bring so much insight and different perspectives to this podcast, which I think is really important, especially when we're talking about mental health and wellness and just everything in general. Perspective and insight is just one of the most important things. But before we get started, we have to do the mindful moment of the week. So this week, my mindful moment was really choosing to do difficult, hard things just solely because it's hard to do, and I still chose to do them. There were things that came up for me this past week that I really didn't want to do because my anxiety was telling me to run. And I chose to do it anyways, and I'm so glad that I did because it helped me kind of conquer that fear. And for anybody who deals with anxiety, you know that the best way to navigate through it is to honestly just expose yourself to the things that you are scared of, the things that you have fears of. This is just the best thing you can do in order to overcome these anxious moments and anxious thoughts. And so that's what I've really been trying to do more social things because social anxiety has been difficult for me, especially since the pandemic. So now I'm really just trying to get out of my shell and push myself to do these things. And so that is why that is my mindful moment of the week. And I would love to hear your mindful moments. So please tag me on our Instagram at Healingwithitpodcast. We would love to hear your mindful moments. But I don't want to ramble on too much because this episode is too good for me to be taking over the intro. So I'm just going to start off by quickly introducing our guest. Our guest is Dr. Khadijah, and she is a naturopathic aesthetician. So she started off by going to naturopathic medical school at Boucher in British Columbia, and she now resides in Alberta, where she practices as a naturopathic doctor and recently graduated from esthetician school. And she puts the two together to create some amazing treatments and really looking at the body from the most holistic perspective that you can when it comes to your skin. And so she's your gal for that kind of stuff. I'm really excited for you guys to hear this episode. We talk about all things imposter syndrome, all things navigating our anxieties and how we kind of grow through them and go through them in life. Anyways, I'm really excited for you guys to listen to this episode. So without further ado, let's get into the interview. I am so excited for today's conversation. I'm here with Dr. Khadijah, and we've been talking for a couple years now, I feel like, and we're just finally getting to actually speak in person, and we're on a video call right now, so I'm really excited to be able to see your face live. So welcome to the podcast.
Thank you so much for having me here. I am so excited to do this. I'm really glad you asked me. Yeah, we've been talking for a very long time. We have such similar interests, so I'm really glad we actually get to talk face to face and record this.
Yeah, honestly, I've loved your content. I don't even know how I originally fell upon your content. I think, I'm just following people who were kind of similar and must have come across yours and start a conversation at some point, whether it was you or me, I don't remember. But I just love that we've been able to keep this connection going for, so many years. And it's really helpful because you've been super supportive and helpful in general through my journey through naturopathic medical school. And as it comes to an end, I'm just like super grateful to have had all these supports from you and just other people who have been through the journey, which kind of brings me into what we wanted to start the conversation with, just like talking about how your journey in naturopathic medical school was, what that was like for you with your mental health and just your overall experience.
Yeah, so I mean, it was a great experience overall, but I will say it was more challenging than I was expecting. I think when you go into any school like that, you're not really aware of what it entails. And I think when you get into a school, there's a lot of excitement and, a lot of preparation that goes into it. And you do your research and all of that. But it's mentally and physically very challenging to go through 4 years of medical school and the depth at which we learn things. You don't realize that before. So that's not a negative thing. It's just, I don't think anybody is prepared for how intense the program is. And I think a lot of people outside of this industry also don't realize the intensity of the program and how much we learn in that 4-year time. So I would say it was life-changing in a lot of ways. I am not the same person I was when I started school, and I think it's a really good thing. I've seen a huge evolution in myself. I have learned things about myself. I found interests that I never had before. It's made me
Mhm.
grow exponentially. So I would say, yeah, it's been challenging, but also very fulfilling.
I can relate to that experience for sure with, going into it pretty blindly. I don't think there's a lot of
Yeah.
information out there about like the depths of the program, which is why I've enjoyed kind of speaking on the program as I'm in it too, because I think it was a very last minute decision for me to do it and probably for the best. I think if I were to read into it too much, I don't know if I would have gone into it. But yeah, it's an overwhelming experience and it changes who you are and how you think and how you interact with the world, which is both good and bad. I think it's interesting to get your perspective from someone who's graduated already, has been practicing as a naturopathic doctor for a couple of years, and, versus me who's still in the thick of it. And I think that's kind
Hmm.
of like two different sides of it. And it's refreshing to hear your perspective knowing that there is like an end to it, because I think oftentimes it feels like there isn't and it's just like going
Yes.
on and on forever. So, no, I always appreciate hearing other people's journeys and knowing that there is an end and that there is a, a light at the end of the tunnel.
Yes, yes, I completely get it because I was in that same space, and I remember, like, that's your world. There's nothing you can't
Hmm.
really see beyond it. You feel like where you are is how it's always gonna be, and I do remember, having supervisors that would tell us, "It gets better. It's okay. It gets better." But you can't it's hard to like, you hold on to that, but it's hard to see because 'cause
Hmm.
you're in it, and there's just that's your whole world. So, I think it's great that you are doing what you do because I wish I had that. Like, I wish I had somebody who was sharing their experiences and talking about mental health as a student because that's so, so important.
Yeah, thank you for saying that. It's definitely not been an easy journey, but even just seeing like people like you who, although you're obviously not in the program anymore, you're still very open and vulnerable on social media about your experiences in life as you navigate through, the next steps, the next chapters. I know like, I've watched you go through like a move and change jobs and career paths and just kind of shift the way that you have been doing things. And so you've been pretty open with how that has impacted you mentally and emotionally. And so even being able to just see people online be their honest selves, which I don't think we see as often as I would like to see, which is, it's not easy to do. So definitely
Yeah,
like I still struggle with it and I still am totally critical in the sense that I also kind of post my highlight reel and have times where I'm not posting about like the mental emotional side of it. But I think just
yeah,
like kind of encouraging people to be a little bit more transparent on social media because it can be both such like a good tool to use, but also like really bad for our mental health to be on social media and
yeah,
see other people's lives. So I
yeah.
think that's a really interesting perspective.
Yeah, yeah, it's definitely challenging to be
Mhm.
vulnerable about that, and it was, something that, like I said, I wish people talked about more when I was in school, and I think I've
Mhm.
always been a very emotional person. I feel things so deeply that it wouldn't sit right with me to go through all these things in my life and not have an outlet or share them
Mhm.
in some capacity.
Yeah, and I feel like me and you really kind of are similar in that sense of kind of being more like the empathetic, more like
Mhm.
emotional type people, like really feeling those emotions, very sensitive to the world and like the outputs. Obviously, I don't want to speak for you and how you experience life,
Yes,
but
100%.
from what I've gathered, I feel like we're
Mhm.
similar in that sense, and I think that in itself can make our experience and perception of the world a lot different than people who maybe aren't so sensitive or maybe don't pick up
Yeah,
on the same kind of energies that somebody who is like a highly sensitive person might actually. So it's good to see, at least starting with people like us who maybe can be more vulnerable only because we feel like that is just us as a person, like more emotional. And if we weren't to post any of that emotional side, then would we really be like our authentic selves, right?
yeah, yeah, exactly. I don't even think I could do social media without that portion of it. It just wouldn't.
No.
I still have my highlight reel too, like you said, but it's still, I
Mhm.
just don't think I would be able to continue it without that portion.
It's interesting to see, like, other people kinda navigate through, medical school, whether it's naturopathic or, like, allopathic medical school, and just, like, seeing their journeys and how different people kind of experience it, and share their journeys online. Like, I know I've seen people who do a really good job at, like, opening up, and then I see a lot of people who don't, and again, this is not to, like, speak negatively on them at all. It's just such like a different perspective. And I think sometimes it's really easy to get caught up on like all of the highlights of it and compare yourself to others going through any experience really that's similar to yours and feeling like you're the only one feeling the way that you do, when in
Yeah.
reality, so many people are feeling very similar things to you. It's not being shared. And so that's why I
Yeah.
really like, I love that you do what you do on social media, and you're just such like a light. I feel like you're such a positive light of a
Thank you.
person, and I love seeing your posts. It always makes me so happy, and just like feeling like I can connect with you.
Thank you. That's really sweet. I appreciate that, and I feel the same way about you. It's just nice to have people who see things that way and who are willing to share the other side of things, because for me the comparison syndrome is was the biggest challenge during school,
Mhm.
was watching people around me and being like, how are they handling this so well? Or my perception of it was that they were handling it very well, but I didn't see
Mhm.
the other side. Or watching people on social media go through medical school or naturopathic school, and watching it be so seamless, and I was just like, but I don't feel that
Mhm.
way. Is there something wrong with me? And so yeah, it's the comparison, and I just don't want other people to fall into that trap, because it's so unrealistic, because everyone has
Mhm.
something. It's just the
Mhm.
level of which they are sharing it.
And I kind of would love to ask you, I guess because we
Mhm.
think about that imposter syndrome a lot. Maybe it's me specifically because I'm just in school right now, but I feel like it relates a lot to being in school. But do you
Yeah.
find that you do or have ever experienced that imposter syndrome now, like while you're out in the world still?
Yes. Yes. I think I've had an interesting relationship with that. It was definitely a lot stronger in school. And I think that's just because of the pressure and the level at which you're performing all the time. It
Mhm.
still exists, and I think that it's something that will actually never go away. And this is something I've recently been trying to work on accepting, that it's actually just not going to go away. It's a very human response to have. And I think with time, with experience, it quietens a little bit, but
Mhm.
I don't think it goes away completely.
Mhm.
So what I do to manage it is I try and be like, you know what? It's called a practice for a reason. That word is always in my head. It's a practice for a reason. And I'm
Mhm.
bringing in new skills all the time. So I activate this imposter syndrome all the time. It comes back and it's overwhelming, but I'm like, it's a practice. I will get better at it. I get more comfortable at it. I get faster at things. I get more efficient. But I think it's always kind of there. And I've just learned to, or I'm learning to accept it.
Mhm. I like that. I like that perspective a lot. I think it's an honest perspective, which we need more of. But I think it's true. I think that these things that we feel are probably going to be like a lifelong journey, but in
Yeah.
certain parts of your life, they're maybe more heightened. You experience
Yeah.
them more and more frequently, and so it feels
Hmm.
like it's going to be like that forever, when maybe it's more of like a situational, like here and there it's
Hmm.
popping up, but now you have the tools to bring it down and you're not worried about that coming up, for the next week, or maybe you deal with
Yeah.
it for like a week and then it goes away for a longer period of time. So it's kind of comforting, I would say, to know that at least it's not like a constant battle.
Yeah. It's one of those things that, I feel like with mental health, it's always a flux.
Mhm.
You learn how to manage and cope. And the imposter syndrome also can be linked to so many other things. And I think working on that, insecurities, anxieties, and working on that really does help. But yeah, it's always a flux. Like there's times when the anxiety and the imposter syndrome and all of that is very high. And then there's times when it's very low. And for
Mhm.
me in the past year, I went back to school. I became an esthetician as
Yes.
well. And so I had to start again. I had to be a beginner again. And
Mm.
so it gets activated again. And then it goes back down as I watch myself bring these things into practice. I feel it, but then it goes away. So it is just it's an up and down all the time.
That's a really helpful perspective. I guess I never really thought about how I know you went back to school, but I never really thought about the
Mhm.
fact that you did your schooling, were out of school for a while, and then went back to school, and what that must have felt like for you to experience those things all over again. So, very interesting. And I'm sure that you probably had some tools to be able to deal with it a little bit better. But at the same time, we're all human and we all experience these things. And like you said, they fluctuate and they come back from time to time. But I think it's amazing that you, in general, have kind of taken your life and really created it to be at least what seems like a little bit more aligned with what works with you. Like I said, I've really enjoyed watching your journey and seeing like the changes that you've gone through the past few years. And I'm sure like there's just been so much on the go for you with everything that you've experienced. I don't know if you'd be open to speaking kind of on like how your journey went from like coming out of naturopathic medical school and like where you went from there and how you ended up to where you are now.
Yeah, sure. So I graduated in 2017 at the Vancouver campus. So I am from Calgary, but I moved there for school and I decided to stay there afterwards to set up practice because I felt like the transition mentally, it was a very mental health decision. I felt like the transition would be easier for me because I had a bit of a network from school. I practiced there for about 2.5 years up until the pandemic hit, and I had a very general practice. I worked with another naturopathic doctor. It was probably the best setup I could have coming out of school because it was very supportive for being a new clinician. So I had a general practice, and I was noticing that I was getting patients who wanted to work on skincare. And they would come to me and want to try different things for their skin. They wanted to get that holistic approach for their skin. And I loved working with them
Mhm.
because I've always had an interest in skincare. And then I would notice that, I could do a lot. We can do a lot naturopathically for skin because there's a lot of different
Right.
perspectives that we're looking at. But I couldn't do the external stuff. They would ask me about products that they were using, they would ask me about their skincare
Mm.
routines, and I would give them suggestions based on what I had tried or the research I'd done myself. But I felt like there was a component missing for me. I didn't want to always have to send them somewhere else and then have to have this lack of communication possibly with the person that they're working with, not sure what's happening on that side of things. So that's when I started
Mhm.
to think about how can I do a little bit of both? How can I bring in the external side of skincare and mix it together with internal skincare? So that's when I just went into, this mode of how can I create what I want to do? And that's when the pandemic hit and I made the decision to move back to Calgary at that time. And that was because my family was all here and I wanted to be closer to them and I wanted to reimagine what my practice would look like so that it would feel more aligned. And it's not that it wasn't aligned
Mhm.
before. I just was really noticing the passion that I had for certain things. So I was like, how can I bring this into my world a lot more? So I moved back and I spent actually, this was not on purpose, but I spent a year just doing my thing. Like I didn't practice for a year. I took a break and it was really, really, really nice. I wasn't, to be honest, 100% sure if I would return to practice, only because I think I needed a mental health break and I didn't realize that until I stopped. And that's when I started my little online business called The Wild Heart. And I created products in my kitchen with herbs and I just got creative because I like working with herbs and I like playing with things and creating things. So I started doing that. I made lip balms and hand sanitizer, all the things. And I still have that, but it was just a really nice moment to see, I'm connecting to this. I like business.
Mhm.
There's an aspect of skincare here, there's an aspect of self-care. So how can I bring this into my practice? And then that's when I was like, I feel like I want to be a medical esthetician as well.
Mhm.
And I looked into programs. I did the program in March and I became an esthetician in July. I started practice again in February. It was a whirlwind in the last year. And now here I am and I'm an esthetician and a naturopathic doctor and I've put the two together and I've just yeah, it's been a really good choice, I think.
I think from what I can see from like what you post, it feels like it's very aligned with the type of person you are. By the way, for anybody listening, her products look absolutely amazing. She does such a good job. So go check out her shop and purchase from her because amazing, amazing products. I have to get products myself. I honestly, I don't know why I have not purchased any yet, but I will. I promise.
No, no worries. I'll send you something.
Oh, amazing. On this topic and what you brought up, I think it just kind of goes to show that you don't have to stay stuck where you are. You can always make choices. You can always decide that you aren't doing what feels completely aligned for you, or maybe it did at one point, and you can shift that, whether it's slight shifts or bigger shifts or both. There's always the option to make these changes. And even when we do feel very stuck, there probably will be a period of time where it feels a lot harder. But as you like slowly work your way through these changes or things that need to shift in your life, it gets easier, and it's definitely worth it to really push yourself to figure out what feels right and what feels aligned and make those changes. Because I think that it's really easy to just stay where we are, stay stagnant, and like you come out of a really hard program, and like you said, you kind of, especially moving so far away, like to another province, you've developed like a community, you've met people, you've had patients from being an intern, all these things, and now it's kind of like, what do I do? So now the next move for you was to start practicing in British Columbia, and then you decided later on that the best move was to move back to Alberta. And I think that just shows that these things are possible, maybe not always easy, and
Mhm.
probably takes
Yeah.
a lot of thinking and a lot of decision making and a lot of planning, but it's worth it coming out on the other side to feel like you're doing what's more aligned, what feels best inside. Like, I think it's just like a feeling. I don't necessarily know how to describe it in
Yeah.
words, but there is like a specific feeling that you get, like that intuitive feeling, the gut feeling really, that I am doing either something that feels right for me, or this just doesn't sit well with me and I need to make change.
Yes, yes, I think that's huge is listening to that gut feeling. And even if it's not like
Mhm.
something's horribly wrong or I'm really not happy, sometimes it's not that intense. Sometimes it's just a gut
Mhm.
feeling that, I feel like there's something else. And that's how this whole journey has been for me. Naturopathic medicine came through a gut feeling. And then as I was
Mhm.
doing it, I was like, I feel like this is the step for me to something else. Like it always felt like that. And I had to keep coming back to that. So I
Mhm.
kept fall. It took me time. Like you're right. It takes a lot of decision making and you have to mull over it for a while because it's not easy to make such huge changes. It's stressful.
Mhm.
But yeah, it I just kept following that feeling and it was like
Mhm.
there's something more and I want to do it my own way and it might not
Mhm.
be what I've seen before, but I still feel like I can make
Mhm.
it my own thing. And I've always been that kind of person. I need to make it
Mhm.
feel very good and very aligned for me to be able to show up authentically. And like we've talked about this with the Instagram, it's the same thing. I just can't physically show up if it doesn't feel very aligned.
Mhm. And it's also important to kind of note that, while looking from an outside perspective now, like you're doing all these incredible things that are so aligned with you. And this just goes for any situation, but of course we're talking about this situation. So it makes most sense to compare it. But you see all these amazing things you've accomplished and how you've aligned, but there's so many things, so many processes that happen in between. Like you started the Wild Heart first, and that was your first, one of your first steps to integrating skincare and that like kind of self-care into your naturopathic practice. And then you moved on to, doing school and again and becoming a medical esthetician, and then integrating that into your practice. Like these are things that take time, they take steps, and they don't always come all at once. In those
Mhm.
situations, I don't know, did you know that you were going to become a medical esthetician when you were starting your business?
No. No. No, I had like an inkling that I wanted to. It was almost like a feeling of being when you're in the treatment room with someone and you have like
Mhm.
this itching feeling like I need to do something else here. Like I was itching to work on the face. And it was such a
Mhm.
weird feeling because I do hands-on therapies as we do as naturopathic doctors. I had acupuncture,
Mhm.
I was doing something called Bowen therapy. And so I had that element of using my hands, and that's been
Mhm.
very important for me. I feel like it can be a bit of it's a different approach, but I just feel like I like to work with my hands. And I feel like
Mm,
I'm doing a lot when I am working on somebody. And so when I had patients with skin concerns, I had this itching feeling of I need to work on their face. And I couldn't
mm,
understand what it was. So I looked into holistic facials. That's what I wanted to do first, was how
okay.
can I just add this on? Can I do training as a naturopathic doctor, but just do holistic facials? But as I did my research, I was like, I just feel like I'm going to add it on and I'm not going to understand the depth of skin and the way to approach things in a not even holistically, but just looking at every aspect of the skin if I'm just learning a
Mm,
skill. So I was like, I need to go and get the in-depth knowledge because that's who I am. I have to learn it all instead of just picking a piece. So that's when the esthetician idea came in because I was like, I think that might be the best way to understand skin
mm.
and then apply it and get the hands-on part of it as well.
Yeah, amazing. And it's great to see, like, there's always going to be a new step. Like, who knows where your journey will take you in 5, 10 years from now. Like, I think it's always changing,
Mhm.
and just being open to that evolution makes, especially like in the type of industry that we work in, like with health and with
Yeah,
people, it's always evolving, it's always changing. So being able to evolve and change alongside it is so important, although very
yeah,
difficult and stressful at times, super
yeah.
important. So I think like your journey is just really inspirational, and a lot of people can probably, benefit from just kind of seeing how you've approached it, how it played out, and how things are evolving and always will. I think like in my position where I am in school, I'm in that almost transitional period of trying to figure out what's
Yeah.
next. And that's a really scary feeling to deal with, as you know. And so
Mhm.
hearing like the other side of it is very important too. Knowing that, yes, there are going to be difficult decisions and changes, but it's just one step at a time. Like, what can I do right now to work towards that? And just those small changes, and really not looking too much at the big picture, because that's probably going to change over time anyways. If I were to ask
Mhm.
myself 5, 6 years ago what I was going to be doing 5, 6 years from then, it would not be naturopathic medical school. And I think a lot of us feel that way, which is why I really am not huge on like the 5 year plan idea, because I feel like we're just always constantly evolving, always constantly changing. And so I think that while having like a general idea of maybe where we want to be is okay, but like having these specific details, I think if we are too far ahead of ourselves, can almost be like way too overwhelming.
Yeah, yeah, I agree. And I think, something I wish someone had told me when I was in school was that you don't need to figure it all out right now. And I think
Mm,
because you try so many things in school, you feel like you have to do them all and you have to do them all very, very well. Like you have to be
yes.
really good at all these skills because you're being tested on them and because the
Mm,
reflection of what you're seeing in school is that way. But I
mhm,
think that it's not like that. My practice has evolved so much, and if I had seen myself during school, I wouldn't even believe it because it is just so different. There's things that I loved in school
mm,
that don't resonate with me anymore, and there's things I never even
mm,
thought possible that I am doing now. So you don't really need to understand what you like and what you're gonna do and how it's gonna look. It's not necessary in school. I think
mm,
the biggest thing is to focus on what you're doing and try everything and then
mhm.
see how things go once you're in practice.
I really like that, because I feel like from first year, people were asking me, what are you going to specialize in? Or
Yeah.
what are you going to focus in? And
Yeah.
it's like, I don't know. I have no idea. Like,
Yeah.
I'm here to figure that out, to try things. And I think that so often we get overshadowed by that idea that we feel like we specifically have to zero in on certain things, when in reality it's like, this is your time period to try these things out and experiment and really figure out what you like and what you don't like. And again, like you said, that can change over time and with the experiences that you go through. So it's important to kind of just know that it's okay to not know what you're doing. Like you said, I think that's really good advice. And I need to listen to that more, because I think I get so overwhelmed sometimes, just feeling like I have to have it all
Yeah.
figured out at this point, and it's just not realistic.
Yeah, yeah. I mean, it's challenging when you're in school, and I think that's
Mhm.
why, even when you get into practice, it's an opportunity to try different things because it's a different ball game. You're on your own. You'll start to just feel like you resonate with certain things, and I think that's actually truly when you start to figure out what you're interested in.
Yes, definitely. So I want to transition into kind of talking more about what you're specifically doing with the
Mm,
skincare kind of aspect of your practice now. So with skincare, I guess I was kind of curious if you have any personal experience with like chronic acne or just like skin issues that really kind of inspired you. I know you kind of were speaking on some things that brought you to here, but was there anything personal that really made you interested in it?
yes, yes. I have struggled with skin issues for as long as I can remember. It's been kind of a roller coaster. So I've had moments where things were fine, but when I was in high school, I had like the typical teenager breakout, but I
Mm-hmm.
was noticing that at least in from my perspective, that none of my friends had the same problem. But I also think that that was just an insecurity, because I was so focused on my own skin. But I had breakouts on my cheeks, and they were really, really bad. And I tried different things, but I was just insecure about it. It was just uncomfortable every time I looked in the
Mm-hmm.
mirror. I just felt gross. I didn't want to look at it. It took a toll on my confidence. I felt like that's all people could see was that part of my skin
Mm-hmm.
or that part of me. And it was just a frustration. And then it developed into covering it with makeup and, just hiding.
Mm-hmm.
And it honestly, it kind of cleared itself up later on, like into university. And that may have been a hormone thing. And then when I was in my early mid 20s, it came back and it was all on my
Mm-hmm.
forehead. And it wasn't a cystic acne, it was little bumps, and it was
Mm-hmm.
impossible to get rid of. I tried everything, and I think that's where naturopathic medicine helped me because I was in school at that time, and I started to
Mm-hmm.
realize how much my gut was impacted and how much it was showing up on my skin. So that's when things started
Mm-hmm.
to move for me. That's when I started to notice, hey, what I'm eating possibly is affecting my skin. And I also probably have had very long standing gut issues that I need to work on. So things kind of evolved from there. And then as I started to understand the external side of it too, they kind of blended together and helped
Mm-hmm.
create a better, healthier skin for me.
It's always good, I think, to hear people's personal experiences with things like that because I feel like I personally dealt with acne. I'm dealing with acne, and it is one of those things that impacts your mental health and the way you perceive yourself and
Yeah.
the way you have confidence or put your confidence out into the world. It changes that and it alters that, even if it might not seem or look that way to other people or might not be such a big deal to other people. It is like the first thing you see when you look in a mirror is your face, right? And so having
Yeah.
acne is one of those things, or just skin issues in general, that makes us feel very insecure because we're so used to identifying with our face. I think it's good to see that, people have these personal experiences but overcome them. And I love when people have personal experiences in like the area that they're working to, because I think that in itself just gives even more of that like emotional factor to what you do. Like you're helping people who have gone through similar things to you, and you're now able to help them in so many ways. And I think that's just really amazing.
Yeah, yeah, it is huge because I understand the confidence aspect of it because it took a hit on my confidence. So when I have
Mm-hmm.
people tell me that it's affecting their confidence, it's huge for me because I know that it's possible to get out of that and see the other side of things. And,
Mm-hmm.
a big thing I get is I just want to be able to not wear makeup. And I'm like, I get that because I was covering my skin for a long time too. And now I don't feel like I have to wear as much makeup. I'm comfortable without it. And so I understand the mental side of it. And that's huge for me. It's always been about working on the insecurity and building confidence and self-care and putting it all together. So yeah, it is an important part of what I do.
Mm-hmm. And so I wanted to know if you could kind of go over some of the more common acne triggers for the audience to kind of learn about.
Yeah. So I look at it in kind of three different tracks. So I have the digestion, gut health side of things. So there are a lot of food triggers for people. The most common ones I see are dairy, gluten, and eggs. Those are the
Mm-hmm.
biggest triggers that I notice for people. But sometimes it's a matter of figuring out if there's other food sensitivities happening, if there's inflammation in the gut, if there's leaky gut happening, if there's dysbiosis, candida, parasites. There's a lot in that realm that needs to be worked on. And I find gut healing is an aspect that is missed for a lot of people. I have people come in who have done food sensitivity testing and they're like, nothing happened. And I find that it's because, food sensitivities isn't a root cause. It is a
Mm-hmm.
reaction to something. So we need to go deeper than that and figure out, why did you get these food sensitivities in the first place? And are we healing the gut? Because that is usually the most important part of working on your digestion. So that's one side of things. And then I see hormones as another kind of area that is a huge trigger for people. And so for me, what I see the most is estrogen dominance and high androgens. And so
Mm,
that's what I focus on for people. But again, it depends on the case that I'm taking and their history, and if we need to do more testing, because sometimes there's a thyroid abnormality. So it really depends on the pattern of the acne, if it's acne we're talking about. So that's one area. And then the other is lifestyle and stress. So that
mm,
one kind of plays into everything, but I do see that sometimes that's the trigger for people is cortisol and stress. And so
mm.
sometimes we just really need to focus on, working on the adrenals or working on lifestyle factors. And a lot of the times it's all three together and possibly other things, but those are the biggest kind of areas of triggers that I see in practice.
Definitely, I think our gut health is so neglected. And I think so many of us
Yeah.
live with a lot of these gut issues because of the lifestyles we live, the world we live in general is not very supportive of a healthy gut. When you go to the grocery
Hmm.
store, the foods that are most accessible, are cheapest a lot of the time, or just marketed better are the ones that are often not good for our guts and are causing these issues with our
Yeah.
guts, but also those external factors too that we see that stress we live in, especially here in North America, such like a go, go, go hustle lifestyle. It's like, just keep going, put your head down and don't, take care of yourself. And I think a lot of young people too, with how universities and colleges and post-secondary and even high school, like those are very stressful experiences. And it's a time in our lives when there's a lot of transition and so much feeling of stress and having to live up to people's expectations. And all these things are huge factors into like how our gut can heal. And people just, I don't think, understand how that connects to everything, but it is like it's crazy how much plays into our gut health.
Yeah, so much. And I think that a lot of that was what I dealt with myself. I had gut issues since forever. I just didn't connect
Mhm.
the two. And
Yeah.
I struggled. I think gut health has been my biggest challenge. For some people, it's hormones, but for me, it has been gut health.
Mhm.
And
Mhm.
I mean, gut health and hormones are highly related too. But I found out I was lactose intolerant when I was in high school. And then I realized that
Mhm.
that's not really where it ends. It gets a lot deeper than that. I found out about my dairy sensitivity and the gluten sensitivity. I found out about all these things. And so it was
Mhm.
playing into my health for so, so long that I didn't realize how much of an impact it was having on my skin.
Yeah, huge impact. And it makes
Yeah.
sense why people, when you're not learning about it, to like think about this connection between, our skin and our gut, like why would you think that they're connected,
Yeah.
right? Like they're totally
Yeah.
separate when you look from the outside, but we just don't
Yeah.
realize how everything connects, and we're not taught about any of that in school. I always think it's pretty wild how little we learn about our own bodies through school, and how much we learn about things like,
Yes.
like the Pythagorean theorem that most people aren't
Yeah.
going to
Yeah.
use later on. And
Yeah.
here we are knowing nothing about our body. So I think it's really cool that you've been able to take these two things. You have so much knowledge on the overall connection of the body from your naturopathic medicine background, but then also being able to learn so much about the skin, because I feel like that's something I don't know enough about, that I'd love to know more about, because there is such a connection. So it makes sense like putting these two together. And then I wanted to kind of talk about what are like the kind of ways that you are right now like approaching the skin, or like what kind of treatments do you offer with your new schooling and all the knowledge that you've gained in the past couple of years.
Yeah. So I try and integrate them as much as possible. So I have created what I call naturopathic aesthetics, but it's basically we do a naturopathic consult, like a regular consult, and that's when I kind of figure out what might be the root cause for you, and then we'll add a treatment on that is targeted towards whatever you're dealing with. So if we're talking about acne, for example, I'll kind of figure out if you're in one of those areas, and then we do the regular kind of naturopathic treatment. So I use herbs a lot in my practice. If we need to do detox, I really like to make sure that there's a foundation happening. So, is the digestive system working properly? Is elimination working properly? Is detoxification working properly? We kind of start there. And I do a lot, like I said, through herbs and supplements, and diet and nutrition, also huge aspects. And then I've been using a lot of chemical peels lately in my practice, which before scared me. I thought it was terrifying, and I didn't even see the point because I didn't understand what chemical peels were. But
Mm-hmm.
now understanding them more and seeing the impact that they have for people is huge because we can do that consult. And then right after, I'm doing a chemical peel if you have acne, for example, and it's going to really move things. It gets deeper into the pores, it's a stronger exfoliation. And so it kind of pulls everything out and it can help with scarring, which is very challenging to treat naturopathically. That's something that needs to be
Mm-hmm.
done topically. So I feel like
Yeah.
putting the two together has really profound impacts for people faster than you would expect if we were just doing one element of it. So
Mm-hmm.
that's kind of the general approach I have. I also do things like microneedling and facials, dermaplaning, but I'd say chemical peels and facials are probably the biggest part of my practice. And then I am bringing in
Mm-hmm.
soon, I'm also going to bring in acupuncture for the face as well. So facial acupuncture, but not yet, but that is something I'm going to be bringing in as well.
Very cool.
Yes.
Very exciting. All this stuff is so interesting to me, and I'm excited to kind of just like see your journey play out even further and see everything that you're up to. Like, I'm always so excited when I see your stories pop up on my timeline. I'm like, I got to see what she's doing today and what she's been up to lately. But no, I love that you've made this connection and you're helping people feel more confident and feel, better in their own skin, which is such like an amazing thing to be able to do, because I think a lot of people struggle with like skin issues, acne, regardless. Like, there is a lot of that confidence that we were talking about. And so I think it's really cool that you've brought these two amazing things and put them together. So if you're in Calgary at any point, go check out Dr. Khadijah. You can go and get these amazing treatments from her. And if I'm in the area, I'm definitely coming to check you out, because I'm just fascinated by this world of naturopathic medicine kind of coming into like the skin realm and the self-care realm. And I'm so thankful that you're able to come on to the podcast today. And I appreciate you just spending, this hour speaking with me and my listeners. I know that they're going to love everything that you've had to say. One thing that I like to ask all of my guests on the podcast is what their morning routines are, because I think it's really fascinating to see like what someone's morning routine looks like, and everyone's is so different. If you don't mind giving us like a little sneak peek into your morning routine.
Of course. Yeah. So it's interesting you ask that because I've had a weird relationship with morning routines. I used to be like very specific about the way I did my morning routine. And recently I've switched that into trying to focus on the rituals versus the routine because I was finding it stressful to make sure I was doing the same thing every day, and sometimes I was tired and I was dragging my feet and it wasn't working for me. So the biggest thing for me is actually just following my intuition, and I know that's not a very it doesn't give you much information, but I basically see how I feel. So I if I need to rest a little bit, I'm going to do that. If I want to wake up and have a coffee, I will do that. If I want to read, in the morning, I'll do that. If I wanna do a workout, I'll do that. I kinda have an idea the night before, but
Mm-hmm.
it is typically a little bit of something for myself in the morning, so it's one of those things. And then, hydration is always, always, always part of it. So I make sure I have, like, a big water bottle, and I have hot water in there because I am a cold person all the time, so I like to have,
Yep.
like, warm to hot water, and I make sure I have that. And then yeah, I do one of those things, and it depends on whether I have patients that day, if I need to go into the clinic or if I'm at home. But it's usually something for myself, something for my mental health. And then eating a good breakfast because that is always important to me as well. Having fruit on an empty stomach and then having a good breakfast that will keep me full for a while. I love chia pudding in the morning. It's the best. And, and then just going through sometimes I have meditation in the morning. I was doing that a lot before, but lately it's been more working out in the morning. So yeah,
Mm-hmm.
it's not the most direct answer, but it's just because it's kind of all over the place and I'm okay with that now.
I like that. I like the intuitive kind
Yeah.
of method of it. And I think that it's just dependent on who you are as a person. So it's like really fascinating to learn how everyone kind of goes about their mornings. And I think there's just like so much
Yeah.
to like, opportunity in the morning to kind of make it your own. So I love that. Thank you for sharing that.
Yeah.
Before we kind of end things, I want you to be able to promote your Instagram and your business. So go ahead, do your little promotion. I want
Awesome.
everyone to
Wow.
hear it.
Thank you. Yeah, so on Instagram, I'm at A Heartful Life. That's the name of my blog and my Instagram. And I have my little business that we talked about that's called The Wild Heart. that's all linked on Instagram. And
Mhm.
then I am currently practicing as a naturopath and an esthetician in two locations in Calgary. So one is at Prima Health and one is at Juvia Aesthetics. And like I mentioned, the services that I provide are a combination of the naturopathic stuff and the aesthetics. And yeah, that's kind of where you can find me and all the things that I do.
Amazing. So everyone go check her out. I'm going to link all of that information too down below to make it easier for them to find you. But again, thank you so much for taking the time to, have these conversations and sit down and speak with me and my audience. I'm so excited to get this episode out there, and I know everyone's going to love it so much.
Yeah, thank you so much for inviting me. And this was so lovely. I love talking about all of this. And yeah, it's just been really nice to meet you face to face virtually. And I do hope that we get to meet each other in person one day soon.
Oh, I would love that so much. Thank you guys so much for taking the time today to tune into this episode. I know how precious your time is and how little time we really get throughout the day. So I appreciate you guys so very much. And please make sure to follow our Instagram and subscribe to this podcast so you can stay up to date with all the new episodes. We are finally back on track and we'll be posting regularly every 2 weeks, every other Thursday. Thank you again. I love you guys so much, and I will talk to you guys in the next episode.